Hello friends, in this video we will learn about syndromes. I will try to cover syndrome associated with developmental disturbances. The first syndrome shown in this picture is Perry-Romberg syndrome. In Perry-Romberg syndrome, half of the face of the patient is normal. Here the face is normal and half of the face is atrophy. So, feature of this syndrome is hemifacial atrophy. Facial atrophy. Next syndrome is Vanderwood syndrome. In Vanderwood syndrome, we see cleft palate, and we also see lower lip pits. Pits are present in lower lip. Moving further, this syndrome is Usher syndrome. What are the features of Usher syndrome? First, blepharocheilitis, double lip, and non-toxic thyroid enlargement. So here in this picture, clinical picture, we can see swelling in upper eyelid. This is known as blepharocheilitis, swelling in eyelid. And here we can see double lip. Okay. And in this picture, we can appreciate non-toxic thyroid enlargement. In exam, they confuse you all by giving the option toxic thyroid enlargement. But keep in mind, here it is non-toxic thyroid enlargement. Next syndrome. Next syndrome is Mishra syndrome. In Mishra syndrome, is also known as cheilitis granulomatosis. Here there is swelling in there is swelling in lower lip. This swelling in lower lip. And it is also known as cheilitis granulomatosis. Next syndrome is median cleft face syndrome. In median cleft face syndrome, we see hypertelorism. What is hypertelorism? In hypertelorism, distance between inner canthus of eye increase. So we see hypertelorism. We see median cleft median cleft of premaxilla and palate. Median cleft of premaxilla and palate. And the third feature is cranium bifidum occultum. Okay, here we can see the median cleft in palate, and it is also involving the premaxillary region. Now, next syndrome is Melkerson-Rosenthal syndrome. What are the features of Melkerson-Rosenthal syndrome? There is cheilitis granulomatosis. There is cheilitis granulomatosis. Cheilitis granulomatosis. Second feature is facial palsy. And we see scrotal tongue. Scrotal tongue is also known as fissured tongue. Also known as fissured tongue. And also known as lingua plecta. Okay, so here we can appreciate here the fissuring in tongue. So it is fissured tongue, the third feature. Which side of face palsy is present? In this side, because patient is unable to close her eye. So facial palsy, and we can see cheilitis granulomatosis, that is swelling in upper. Here the swelling is present in upper lip. In Mishra syndrome, the swelling is present in lower lip. Moving further, this Peutz-Jeghers syndrome. In Peutz-Jeghers syndrome, it is also known as hereditary intestinal polyposis. Hereditary intestinal polyposis. Because in this we can appreciate multiple intestinal polyps. Okay, multiple intestinal polyps are present in this syndrome. And we can see pigmentation on face and oral cavity and hand. So pigmentation are also present in this. Okay. So pigmentation are seen in oral cavity, lips, and hand. Hands. Okay. Now next syndrome is Beckwith-Wiedemann syndrome. Is also known as Beckwith hypoglycemia. Also known as Beckwith hypoglycemia. Features are shown in the figure. There is microcephaly. Okay, and also mentioned here, there is microcephaly. There is macroglossia in this, and another term for this is organ visceromegaly. Okay, fetal visceromegaly. Fetal visceromegaly. Visceromegaly. Okay, moving further. Rubinstein-Tybee syndrome. The main feature of Rubinstein-Tybee syndrome is talon's cusp. Okay, so first feature is talon's cusp. There is also developmental retardation present in the patient. Okay, developmental retardation. And we see broad thumb here, broad thumb and big toe, big great toe. Okay, so broad thumb and big great toe, big great toe. Okay, and there is delayed or incomplete descent of testis. Next syndrome is LAADD syndrome. So LAD syndrome, in this syndrome, L stands for lacrimal apparatus. ठीक है, L stands for lacrimal apparatus. In this, involvement involvement of lacrimal apparatus with lacrimal sac inflammation, and there is also lacrimal gland aplasia. Okay, so there is lacrimal gland aplasia, lacrimal sac inflammation. Next, A stand for auricles defect. ठीक है, तो auricle are deformed in these patients. Auricle are deformed. They appear cup shaped. Na? Here in this, auricles are deformed. Yeah, and they appear cup shaped. They appear cup shaped. Next, D stand for dentition. There is dental involvement. Okay, so what are the features in dental involvement? There is peg lateral here. So we can see peg lateral. We can see hypodontia and enamel hypoplasia. Next, D stand for digits. Okay, there is deformity in digits. So what is this deformity? Distal deformity is deviation of finger either medially. Here finger is deviated now. They are deviated either medially or lateral. Digit deformity. Deviation of fingers either medially or laterally. Term given to this condition is clinodactyly. Clinodactyly. Thank you.